In this video, we'll look at the four components of a physical therapy soap note, sometimes referred to as a treatment note or a daily note. I'll also show you how I write a daily soap note, and we'll go over a few examples and give you some tips on how to speed up your documentation as well. And if we haven't met before, I'm Tim Fraticelli, and I'm a physical therapist and founder of PTProgress.com. And on this YouTube channel, I share videos about career, treatment, and technology, so be sure to subscribe to the channel for helpful videos each week. And a big thanks to MedBridge Education for sponsoring a portion of this video, and for giving you $175 off of MedBridge when you use the promo code PTProgress. I'll share a little bit more about that later in this video, but first, let's talk about daily treatment notes. Writing a physical therapy daily treatment note is really straightforward when you use the SOAP note approach. SOAP stands for Subjective, Objective, Assessment, and Plan. The subjective section covers what the patient or family member tells you. Sometimes you have to draw it out from them a little bit, but usually they'll say something like, "My arm is feeling really sore from sleeping on it last night." And that's great because you just wrote the first part of the subjective line. You can still go into more detail, but if you do, you should really use that time to focus in your note and write out how it's affecting their ability to perform functional tasks. Here's an example. The patient reports difficulty sleeping on his side due to shoulder pain. He presents today with 4 out of 10 pain along his left biceps. Reaching behind his back to tuck in his shirt has become easier over the past week. You don't have to write out every single detail they discuss, but if it's important or if it helps someone to understand how they're restricted at home or in the community, then write it down. Don't just write, "I feel good today," or "the patient has no pain today." Bring the functional component into the subjective section. I usually like to follow up with a leading question like, "What kind of activities seem easier to perform with your shoulder lately?" which usually leads them into discussing more of a functional movement. You don't have to complicate this section. I can usually write a sentence within a minute or two of welcoming the patient into the clinic, and that usually sums up what you need to know with the subjective section. Here's one last example, then we'll move on to the objective section. Today, the patient reports increased swelling in her right knee. She attributes this to walking more than 20 minutes last night at the grocery store. She is still hesitant to leave the house without her walker. Okay, so let's talk about the objective section. This includes all of your measurements, your vital signs, treatments, procedures, and special tests that you performed that day. This is where the note can get a little bit long. Some clinics use a flow sheet to track exercises and treatments, which I prefer, and other EMRs have flow sheets built into the program requiring you to click 27 checkboxes. But still, there are other clinics that require you to write out each activity or exercise that you do in a paragraph format, like the following example. Partial squats 3 times 10 reps, Romberg stance with perturbations 3 times 30 seconds, single leg stance with handhold assist 3 times 15 seconds, standing hip abduction extension 3 times 10 with yellow band, lateral step ups times 15, front step over 10-inch hurdle at 10 times at parallel bars, supine straight leg raise 3 times 10, cold pack 10 minutes, and supine to right knee. Now, regardless of the treatment method, you need to be specific to include things like repetitions, resistance, assistance, equipment, direction, cueing, and any other required identifiers to help someone else who may treat that patient next. Some systems have open text areas to remark on observations you make, such as these examples. Posture, right scapula abducted and internally rotated while sitting. Patient lacks full upward rotation of right scapula on active shoulder flexion. 120 degrees of right knee flexion. 0 degrees of right knee extension noted. Before we get into the assessment portion of a therapy note, a quick word about today's video's sponsor, MedBridge Education. I've been using MedBridge for over 3 years to complete my continuing ed requirements online, and I just renewed it using the PT Progress discount, which saves you $175, and it allows you to renew each year at this discounted rate. They're constantly coming up with new courses, and it's really easy to get live CEUs through their online webinars, which can count towards in-person CEUs that I need for my state license renewal. I also use MedBridge every day in the clinic to create home exercise programs for my patients because it's one of the most comprehensive library of treatments, and the MedBridge Go app is really simple for patients to use as well. It's just one of the resources that I use to be more efficient in the clinic, and if you're interested in using MedBridge, you can use the promo code PTProgress to save $175 on MedBridge this year. Okay, now for the assessment section of the daily note. Every note needs an assessment. A good assessment relays what skill you provided and why you are even needed as a physical therapist. Don't just write, "The patient tolerated treatment well." That's absolutely horrible, and it doesn't help anyone understand the skilled treatment that you actually provided. A better approach is to comment on the impairments that you identified during the session, the response or the change you noted with your corrections that you made, and how you advanced the patient further towards achieving their goals. Also, if you identified functional tasks in the subjective section, this is a great place to relate them into your treatment. Here's an example. The patient demonstrated poor coordination with ascending stairs, putting him at greater risk of falling at home. Verbal cueing to emphasize increased hip flexion allowed the patient to clear his foot completely to avoid catching on the step. Okay, here's another one. The patient demonstrated poor upward rotation of the scapula with right shoulder flexion. Tactile cues and manual support of the scapula decreased popping in the shoulder when reaching overhead. Writing better assessments takes practice. It's easy to get into a rut or to experience writer's block, which is why I created the therapy assessment documentation templates, which gives you 60 assessment examples for some of the most common exercises performed in therapy. You can see a link to those in the description below or by visiting ptprogress.com/templates. All right, so the fourth section to consider is the plan. This section, we identify the next steps with the patient. Is someone else seeing the patient? What should they know? What do we want to work on with the next visit? This section is really important because sometimes you might not see that patient for another week or maybe even 2 weeks. It's your job there to write a helpful 1 to 2 sentence plan to identify any other exercises or approaches that you want to take to progress the patient. Here's an example. Provide the patient with green TheraBand to progress with hip abductor strengthening with lateral stepping exercise. Focus on quad strengthening through standing exercises and balance activities like single leg stance on AirX balance pad. Alright, here's an example of a daily note. It doesn't have to be long, but it needs to include the components that relay the skill that you provided during the session. Alright, in the subjective section, we're going to be looking at things like their pain level that day, functional abilities or limitations, or areas of improvement or continued difficulty. It's helpful to use patient quotes on how they're feeling, so try to integrate that into subjective statements if possible. Here's an example. The patient stated, "I'm better able to sleep at night with less throbbing in my knee. Today, my pain level is 3 out of 10. Okay, now on to the objective section. This, of course, includes things like the exercises and treatments performed, any measurements that you've taken, balance or strength tests that you performed, special tests, and other things like that. Here's the example. The patient used front wheel walker to ambulate into the clinic with equal step length noted. 20 minutes of therapeutic exercise, supine exercises included active quad sets, and so on. You could read the full example right there. In the assessment section, this covers the therapist's insights on performance and progress towards the patient's goals. This also includes the patient's response to treatment and answers the question, why should therapy continue? Or what is the focus? What's the reason behind the treatment? This example assessment is as follows. The patient demonstrates lack of quad muscle recruitment during knee extension. Instruct the patient in co-contraction of quads to improve motor recruitment in order to achieve greater knee extension. Poor balance on uneven surface noted during treatment. Continue use of front wheel walker recommended. And finally, on to the plan. What will be the focus of the next treatment or areas to address the next visit? Is a progress note due? What should someone know about the next treatment? In this example, the plan is to progress the patient with strengthening exercises to increase quad activation and trial straight cane at parallel bars. Alright, now you know how to write a daily treatment note. Be sure to watch the other videos on how to write a therapy evaluation as well as progress notes. And if you want to see all of my notes, take a look at the therapy documentation templates for over 60 assessment examples to help you save 30 minutes a day on your documentation. You can get the link to those in the description below, along with the MedBridge coupon to save $175 on continuing education this year when you use the promo code PTProgress. Hey, thanks for watching the video, and be sure to subscribe and to keep watching for the next video on how to write therapy assessment phrases faster. We'll see you there.